Hey, 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 it's your favorite remote work enthusiast, Delilah. Happy Monday and happy MLK Day. Now, I am back with a hot work from home opportunity. This is something you guys have been requesting. You said, Delilah, where's the part time? And I am happy to tell you that I have the first part time job lead of the year, and I hope many more come after this. Now, part time is not easy to find, especially when you're trying to check off all the boxes. You want to be paid well, you want to work for a company that isn't going to drive you crazy. Okay, it doesn't have all these crazy high requirements and all these duties that you got to jump through hoops to do. Okay, it's not easy, but I found one. So we're going to get into all of the details, but first, please make sure you hit the subscribe button, you tap the notification bell so that you don't miss out on any of these hot work from home opportunities that I share every single weekday. And on that note, we are ready to jump in. Okay, so I just already know this is somebody's job. Like, I know somebody is like, this is exactly what I've been looking for. Now, before I get into the lead, I do want to share with y'all that Privia Healthcare, which is the company that I'm sharing, and I've shared them many times on my channel before, they have multiple US-wide remote positions available. And if you're on their careers page, which is where I am right now, they make it easy for you by just toggling this box here so you can see exactly what they have available remotely. Now, I do want to let y'all know that they have a patient tech support specialist position that I think is an awesome opportunity. And they also have a care center support billing specialist role. These don't have high requirements. They pay about like $17 to $18 per hour. And I would also apply to those if you're not allergic to a phone, okay? So those are some good leads that they have available. Now, the lead I'm getting into is this virtual clinic care coordinator role. It's part-time, so let's take a look at it. Okay, so we are looking at the virtual clinic care coordinator part-time role from Privia Health. They let us know that the hours for this role are going to be about 16 to 25 hours per week, and you can earn up to $20 per hour. I would ask for the 20, not just because I'm always telling y'all ask for the most, but based off of what you're doing in this role, it's not a long shot at all to ask for 20. And I don't think they should give you any pushback on this, especially if you have experience being like a coordinator or some type of assistant or anything in the realm of like front desk office type work. Okay, $20 is easy to command here, in my opinion. Now, they let us know the schedule. It's weekdays, 12 to 4 p.m. Eastern. And then on weekends and holidays, the hours could be anywhere from 8 a.m. to 8 p.m. Eastern time. So if you're someone who wants to do part-time, but also get your part-time hours during the weekend, then they have availability for that. But if you're someone who wants to work weekdays, it looks like from 12 to 4 p.m. Eastern, like that's very specific. You could hit 20 hours a week with, the weekdays. Now, they might require just one weekend day or something like that. And then you have a lot of autonomy with when you would work the weekend hours, but they don't specify if a weekend day is required. So for everyone who's looking for something Monday through Friday, I would still get my application in because it's highly likely you could just do Monday through Friday, 12 to 4. That would be 20 hours a week. But if you're someone who wants to also get a weekend day in there, you have that option. And I'll also point out, I look at a lot of leads. I rarely ever see part-time hours during this time frame. So if you're someone who wants to like work around maybe your kid's schedule, or you have some other stuff you're working around, if you work from 12 to 4, middle of the day, you would be able to still do all you got to do with your kiddos, and maybe they might do a little after school program or play a sport, and you'd be available to pick them up and you wouldn't skip a beat. So this is a good schedule in my opinion, and I don't see it very often. So jumping into the lead here, they talk about the company. They are a national physician platform transforming the healthcare delivery experience. And if you check out their Glassdoor, they have a lot of information for you there as well, along with reviews, and you can check out their benefits and interview process. So a lot of great info here, but we'll just skip to the job description. So it says job description, estimated hours of work per week, maintain an average of 16 to 25 hours per week, rate of pay based on experience up to $20 per hour. Estimated schedule, weekdays 12 to 4 p.m. Eastern time, weekend/holiday hours between 8 a.m. to 8 p.m. Eastern. The virtual health coordinator will work closely with PVH providers to provide real-time support for both the providers and patients, leveraging the virtual clinic service. The coordinator will also work closely and in support of telephonic care advice line registered nurses, population health support staff, primary care providers, and networked partners to provide real-time call queue support for care advice line functions not requiring RN licensure, i.e. independent clinical assessment. Primary job duties. Support communication between the patients entering the virtual clinic queue and the providers that are extending their services. Monitor internal systems, Athena, chat, email, etc., and follow required protocols to provider and patient outreach. Manage expectations around wait time for patients and troubleshoot issues with providers, patients on our virtual health platform. Answer and address incoming calls promptly and in according with SOP and training guidelines. Effectively manage communications, both written and verbal, to all patients, caregivers, peers, and healthcare providers. Collaborate effectively with integrated care team to support care coordination for patients. Answer and resolve business office inbound calls related to population health, care coordination, or other clinical activities. Assist in managing the virtual clinic's administrative inbox and completing the tasks as needed. Assist with patient reporting and tracking as necessary. Make appropriate referrals to internal care team, payer programs, community resources, home care, and disease management programs. Support the care advice line by accurately identifies patients, caregivers, and their primary purpose and need for calling the nurse line. Triages and transfers call in case appropriately to RNs, providers, team members, and 911. Participate in quality assurance process, schedule and coordinate visits for target populations, and follow through to ensure visit completion. This may include but not limited to outreaching to schedule annual wellness visits, emergency room follow-up, new patient visits, etc. Assist with appropriate and miscellaneous projects as assigned. Qualifications. Preferred experience with professional telephonic or remote communication, prior experience working in a healthcare setting, prior experience with Athena EMR preferred, ability to work evenings, weekends, and holidays, must comply with all HIPAA rules and regulations. Additional information, communication methods used, Google Chat, email, phone, and 8x8. And then it says Privia Health is committed to creating and fostering a work environment that allows and encourages you to bring your whole self to work. Privia is a better company when people are a reflection of the communities that we serve. Our goal is to encourage people to pursue all opportunities regardless of their age, color, national origin, physical and mental disability, race, religion, gender, sex, gender identity and/or expression, marital status, veteran status, and any other characteristic protected by federal, state, or local law. So that's their equal opportunity employment statement. And then down here it says technical requirements for remote workers, which is us. So it says, in order to successfully work remotely, supporting our patients and providers, we require a minimum of 5 Mbps for download speed and 3 Mbps for upload speed. This should be acquired prior to the start of your employment. The best measure of your internet speed is to use online speed tests like the link that they gave you here. And it says this gives you an update as to how fast data transfer is with your internet connection and if it meets the minimum speed requirements. Work with your internet provider if you have questions about your connection. Employees who regularly work from home offices are eligible for expense reimbursement to offset this cost. So, what that means is you'll go here, you'll do an internet speed test, and then you just want to make sure that you meet this mark. Now, let's say for some reason you fail the speed test, okay? And by fail the speed test, it just means you didn't have the 5 Mbps download and the 3 Mbps upload. That's a simple fix. You just get on the phone, you call your internet service provider, and you just bump up your internet speed package. And I don't even think most times they even have to come out to your house unless for whatever reason your stuff is just outdated. But for most folks, it's just a phone call. And then notice they're going going to give you an expense reimbursement to offset this cost. So it looks like they're going to foot the bill for your internet service anyhow. So that's awesome. And, I know this is going to be very helpful for a lot of people. Now, I just want to come back up here and point out that this truly is like a coordinator position. You're supporting the care advice line nurses, you're supporting the population health staff, and then the primary care providers. Yes, there will be some phones involved, but this is a great opportunity to get experience that will build up your resume, because I see a ton of coordinator positions in the healthcare industry that are remote, and a lot of them are non-phone based. So if you've been trying to get to that place where you're doing online healthcare coordinator roles that don't require a phone, this could be a great way to bridge that gap. Get the experience doing these things, and then you'll be more employable for those full-time non-phone care coordinator roles. And like I said, there's a ton of them. So anyway, all right, I'll let y'all go on with your MLK day. But if this is your lead, the I'm interested button at the top right will take you to the application process. And then lastly, I just want to point out, if you don't have your home office equipment, you need to check out my Amazon storefront. In my Amazon storefront, I have picked out computer packages that are quite affordable. These packages meet 99% of company specs. So every company has specs for what they require you to have as far as your home equipment goes, so that you can support their apps and programs. And these computers will do the trick. Now, I've been telling y'all, okay, you don't have a whole lot of money, but you need something. This package will suffice, okay? This one and this one go back and forth between being the two most economical in this lineup. Now, if you already have a monitor and you don't really need a monitor, there are other ones here. Usually this one's a little bit cheaper, but new year, everybody's trying to work from home, so maybe they jacked up the price a little bit. But yeah, okay, everything you see here will do the trick. Windows 10 Pro, wired keyboard and mouse, 19-inch monitor, and they'll get it to you in a jiffy. So check out my Amazon storefront. I have the computer equipment you'll need to succeed. And as well, if you want to get your application in for more jobs, which I highly recommend, check out the mega list of jobs. Oh, look at this. We updated the mega list of jobs. So there were 446 companies last time we looked at this list of jobs. There are now 470 companies on this mega list of jobs. Me and my team check out all these companies. We research them. You got to do your own research, but these companies all will hire you to work from home. And you can search this list for, some key terms. If you're looking for something like health care, you can type that in, and then boom, you can see all the health companies we have. 68 companies. Plenty of places for you to get your application in. So definitely bookmark this page, make it part of your rotation when you're applying to jobs every day. And on that note, go ahead and get that application in. Thank you so much for watching. I truly hope this has been helpful, and I will talk to you soon. Bye.